When I was 8 years old in 1953, I couldn't see the chalkboard, so my parents took me and got me glasses. Each year I went back to the eye doctor, the glasses became thicker and thicker. These eyeglasses that is very demonstrative of how severe my nearsightedness was. When I was 18 years of age, I got hard contact lenses so I wouldn't have to wear glasses anymore. The hard contact lenses hurt a lot, they were very thick, and I had to have them tinted to accommodate the glare. But I was committed to wear them, and I wore them 55 years. One of the reasons that provoked me to have this surgery is the fact that I got to renew my driver's license. I was afraid I might not pass the driving test if I didn't improve the vision. I had been diagnosed with cataracts before that I ought to have cataract surgery, so that was the catalyst that provoked me to make this appointment. I chose Marietta Eye Clinic because my regular primary physician had made the recommendation. The staff was very accommodating. They were enjoyable to be around. It was a very pleasant experience to come to Marietta Eye Clinic for this procedure. They removed the cataracts in both eyes and implanted this permanent lens. So I no longer had to put in and take out contact lenses. I didn't have the darkness from the cataract, and I could see. And it was just miraculous. And I'm so grateful for that, so happy. It's something that I don't think most people experience. So pleased with how kind and accommodating the entire staff at Marietta Eye Clinic were, how competent they were. They walked me through each step, rolled me in, rolled me out, and I was ready to go. That was the experience. So the surgery wasn't scary. It wasn't painful at all. Your cataract surgery and other eye needs will be taken care of competently and professionally and courteously by Marietta Eye Clinic because I have experienced it myself. The people here were wonderful. I want to continue the relationship with the Marietta Eye Clinic for my eye care hereafter. Thank you, Marietta Eye Clinic, for this miraculous improvement in my life.
As you may know, cataracts are a natural part of life. But did you know there are nearly 4 million cataract surgeries performed in the U.S. every year? Let's discover some other helpful facts about cataract surgery. Cataract surgery is one of the most common procedures performed in the U.S. today. The surgery itself typically takes about 15 minutes, with an additional 1 to 2 hours to rest in the surgery center immediately after the procedure. Think of the procedure like replacing a frosted window. If you can't clean away the frosted cloudiness, the window becomes difficult to see through. A cataract clouded lens in your eye works in the same way. During cataract surgery, the surgeon removes the cloudiness by replacing the lens, just like you would replace a window pane. With a new window pane in place, you can see clearly again. After cataract surgery, your vision will be clearer and brighter. And the good news is, you may be able to correct other vision issues, like astigmatism or presbyopia, during the surgery with different replacement lenses. These types of replacement lenses can even reduce your need for glasses. Most people take 1 or 2 days to recover after surgery, but make sure you ask your doctor about activities that are safe and about the risks involved in the procedure. Get to know your replacement lens options and how you can clear away the cloudiness of cataracts. Talk to your eye doctor about the risks and benefits of cataract surgery to find out your surgery options and what replacement lens could be right for you.
I work on the computer all day long, and I work with a lot of numbers and a lot of calculations. My vision was dimming, and I didn't realize it until afterwards. And it was like I had a gold, amber filter over my eyes when I would look out. You know, it was so gradual. It was so gradual that I even said to my eye doctor one time, I said, I don't think the cataracts are that bad. And she's like, oh yeah. You know, they check your heartbeat, they give you some medicine to relax you before you go in. And then you have the surgery, and then he comes and picks you up and you go home. From the time that I walked in until I walked out, I would say less than 2 hours. I thought afterwards I might feel some pain, but never any pain. And after the surgery, I could see colors clear. I could see the whole world much, much clearer, and I had no idea. I mean, from everything to like a leaf, flowers, and I had no idea that what I was looking at before wasn't normal. When I had my surgery done, I had it on Wednesday. I worked from home on Thursday, and I went back to work on Friday. For years, I mean, I'm talking 40 years more that I wore contacts. It doesn't break the habit overnight that, oh, I don't have to take these out anymore. And that, for so many things, I'd be like, oh, got to put my contacts in or take them out. And no, I don't. And if I had to do it over, I mean, even after I had to pay the money out of pocket, if I had to do it over, I wouldn't bat an eye. I would get these again. No question about it. It's more than I ever could have dreamed. It's more than I ever could have asked for. What does it allow me to do? Everything.
When light passes through a clear lens, the light can focus to a point, creating a clear view. Over time, the lens becomes cloudy or opaque and develops into a cataract. When light passes through a cataract, the light gets distorted, creating a blurred view. Compared to vision with a clear lens, your vision with a cataract may look fuzzy and colors might be muted. These visual disturbances from cataracts are progressive, and when they become bothersome or limit your daily activities, it's time to consider treatment. Treatment for cataracts involves removing the cataract and replacing it with an intraocular lens implant. Many of the steps of cataract surgery that are traditionally performed using handheld tools can now be completed with a laser. Using the Catalyst Precision Laser System, your surgeon can provide you a comfortable, gentle, more accurate, and highly customized treatment. How does Catalyst work? Every eye has a unique size and shape. Prior to treatment, Catalyst scans the eye, making a precise 3D map of relevant structures. This process enables your surgeon to create a highly customized treatment plan that is tailored to your eye. How does laser cataract surgery with Catalyst compare to traditional manual surgery? In traditional cataract surgery, your surgeon uses handheld blades to create incisions in the cornea for accessing the cataract. Your surgeon will then use a surgical instrument to manually create an opening in the lens capsule that holds the cataract. The goal in these steps is to make the corneal incisions precise and the opening in the lens capsule as circular as possible, in the right location, and size to fit the replacement lens. With Catalyst, your surgeon can use the laser to make the corneal incisions with exceptional precision. Moreover, your surgeon can create the circular opening with the exact intended size, shape, and location using the precision of the laser. Clinical studies have shown that with Catalyst, the circular opening is approximately 10 times more accurate than what is achievable by hand. With Catalyst, your surgeon can also use the laser to soften the hard cataract and segment it into manageable pieces before ever entering inside the eye with instruments. Shown here is a Catalyst laser grid pattern. The next step in both the traditional and Catalyst procedures is to remove the tissue and break up and remove the cataract. In the traditional approach, your surgeon will insert mechanical instruments into the eye and use ultrasound energy to initiate breakup of the hard cataract into pieces that are small enough to be removed. In laser cataract surgery with Catalyst, the softening of the lens by the laser enables your surgeon to remove the cataract more gently and with significantly less ultrasound energy than is used in traditional manual cataract surgery. This gentle, low-energy approach may make your visual recovery more rapid. For both traditional and Catalyst procedures, The precision of these steps sets the stage for accurate positioning of the replacement lens. And accurate positioning of the replacement lens is critical for achieving the desired visual outcome. Depending on your preoperative vision and desire for reduced dependence on glasses, your surgeon may recommend a treatment plan that could include a specific lens implant type and additional incisions in the cornea. In traditional cataract surgery, these corneal incisions are made with a handheld blade. With Catalysts, your surgeon can create these incisions exactly as intended with laser precision. What are the benefits of laser cataract surgery? With Catalysts, your surgeon can provide you with a highly customized treatment with advanced 3D imaging, a treatment with little or no discomfort, a more precise treatment, a gentler and easier cataract removal, and generally, a more rapid visual recovery. To find out more about the new standard in precision cataract surgery, ask your doctor if cataract surgery with the Catalyst Precision Laser System is right for you.
You may be thinking about surgery to replace your eye's natural lens with an artificial lens for better vision. This may be because you have a cataract or because you want to be less dependent on glasses or contacts. Whatever your reason, there are several types of lenses to choose from. These lenses are called intraocular lenses, or IOLs. An IOL is implanted permanently in your eye. It allows light to pass through and focus properly on the retina, restoring your clear vision. If you are having cataract surgery, your eye surgeon will remove the cloudy natural lens from your eye and replace it with an artificial lens. The most commonly used lens is called a monofocal lens. A monofocal lens provides clear vision at one range without glasses or contacts. Many people choose to have their monofocal lens set for clear distance vision. This usually allows you to do things like drive or play golf without needing glasses or contacts. Keep in mind that with a monofocal lens set for distance vision, you will likely need to wear glasses for reading or close work. Also, in some cases, you might need glasses to help fine-tune your distance vision too. If you want to reduce your dependence on glasses at all distances with a monofocal IOL, then monovision may be the solution. Monovision is when one eye's lens is set for good distance vision, while the other is set for good vision close-up. Your dominant eye is usually the one corrected for distance vision. Despite having a different focus, both eyes still work together for clear vision at most distances. With monovision, the eye that sees distant objects clearly will see close objects as blurred. The eye that sees well up close will see distant objects as blurry. The brain learns to adapt to using one eye or the other depending on the task at hand. A monofocal lens is usually paid for by insurance as part of cataract surgery. There are other types of lenses that provide more vision options. They are called premium or enhanced lenses. If you are having cataract surgery, you will have to pay extra for a premium lens since insurance only pays for a monofocal lens after cataract removal. One type of premium IOL is called a multifocal lens. It provides clear vision at more than one distance. Multifocal IOL has focal zones or rings that allow you to see clearly at both near and far distances. With a multifocal IOL, your brain learns to automatically select the focus you need for the activity you are doing. For people who have astigmatism, there are IOLs called toric lenses. A toric IOL is designed to correct the blurry or distorted vision caused by your astigmatism. The toric lens helps focus light more effectively on the retina. A toric lens may significantly improve your distance vision. However, you will still need glasses for reading. There are new types of toric lenses that not only correct distance vision for people with astigmatism, but can also provide clear vision up close and at mid-range. Depending on the type of toric lens, glasses might still be needed at certain times for reading or close work. Your ophthalmologist will be happy to discuss your vision needs and expectations and help you understand the pros and cons of the different types of lens implants. If you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
You may know that almost everyone gets cataracts, but did you know that up to 52% of people with cataracts also have trouble seeing far away because of astigmatism? And almost 100% of people over 40 start having trouble seeing up close because of an eye condition called presbyopia. As they age, many people will have all three of these eye conditions at the same time. So let's learn how they can affect your vision. If you have cataracts, it means proteins have built up on the lens inside your eye, clouding your vision. If you also have astigmatism, your irregularly curved cornea distorts light entering your eye, making things appear blurry. And if you also have presbyopia, it means your lens has become inflexible over time, making it difficult for the muscles around the eye to focus your near vision. When you have all three conditions, your vision is cloudy, blurry, and you have difficulty seeing up close. Fortunately, Alcon created lenses that correct cataracts, astigmatism, and presbyopia in one procedure to help you clear away the cloudiness and focus across all distances. Best of all, a multifocal toric lens can help reduce your dependency on glasses after surgery. Talk to your eye doctor today about lens options that also correct astigmatism and presbyopia during cataract surgery.
I'm Ron from Austin, Texas. I love the outdoors. I love to be outside. I did not know that I had cataracts. I just knew my vision just seemed to be a little cloudier, just not quite as good. And it was a very gradual process. It wasn't overnight. It was the last thing on my mind. I thought that was for folks that were maybe older than me, and that wasn't the case. It was me. I didn't know what to think when he told me I had them, other than I wanted to know what my remedies were, what potential solutions were. So I chose to have the distance put into both eyes, and for me it was the right decision. It was a toric lens. By the time I figured out what was going on, literally it was less than 10 minutes. I was out, I was done. There was no pain whatsoever. As soon as I was able to have those the coverings taken away, I could tell right then and there. The clarity was there, the cloudiness was gone, and just looking at the leaves and seeing the detail on those. I never saw that before, so to me that was kind of the wow factor. I was expecting maybe a step up like I did each time I had glasses or I had new contact lenses. Maybe I could see a little bit better, but this was a big jump up from what I was used to. I had the surgery on a Thursday. I think I took Friday off and I was back at work on Monday. Just the opportunity to get that clarity, to see so precise and so clear, I'd recommend it for everybody. Vision's something you don't get a second chance on, and so for me to have, at my age, have the vision that I have today, I wish I had it 20, 30 years ago, but I'm seeing the best I ever have in my life. So for that, how do you say thanks?